Mother Bear fetched ice packs for a burned toddler in Pediatrics. What happened next was shocking. Let us know where you're watching from. If you love my content, consider supporting it with a super thanks. Also, don't forget to like and subscribe. It'll help us to remain in touch with amazing people like you. The hospital smell hit Grace Martinez the moment she stepped through the automatic doors. That sharp mix of antiseptic and worry that every parent knows too well. Her 2-year-old daughter, Luna, clung to her chest. Tiny fingers wrapped around Grace's shirt. The burn on Luna's left arm was covered with fresh bandages, but Grace could still hear her daughter's screams from 3 hours ago when the accident happened. "Room 312, the receptionist said without looking up. Grace's husband, David, walked beside them carrying a small bag with Luna's favorite stuffed elephant. His face was pale, guilt written across every line. He had been the one watching Luna when she reached for the hot pot handle. The pediatric ward felt different at night. Quieter. Only the essential staff remained, their footsteps echoing down long hallways painted with cheerful animals that looked creepy in the dim lighting. Grace noticed how Luna's eyes darted around, taking in the strange new world of beeping machines and rolling IV stands. "Here we are," David whispered, pushing open the door to their assigned room. The bed looked enormous compared to Luna's tiny frame. A nurse with kind eyes and graying hair appeared almost instantly. "I'm Nurse Patricia," she said, her voice gentle. "We're going to take good care of Luna tonight. The doctor wants to monitor her burn closely and make sure she stays comfortable." Grace settled into the uncomfortable chair beside the bed while David helped Luna get situated. The little girl whimpered as Patricia checked her bandages, but she didn't cry. She had cried enough for one day. Outside their third-floor window, the Willowbrook Nature Reserve stretched into darkness. The hospital had been built at the edge of the preserve, and during the day, patients could see hiking trails and dense forest. Now, only shadows moved among the trees. What Grace didn't know was that those shadows were watching back. Deep in the preserve, a mother black bear named by local rangers as Bella had been pacing restlessly for hours. Her cub, barely 6 months old, stayed close to her side. Something was wrong. Bella could sense it the way animals sense storms before they hit. Her maternal instincts were screaming, but she couldn't understand why. Back in room 312, Luna finally drifted off to sleep around midnight. Grace held her daughter's uninjured hand, watching the steady rise and fall of her small chest. David had gone to get coffee, leaving mother and daughter alone in the quiet room. That's when Luna started crying again. The sound pierced through the hospital walls and traveled across the parking lot, through the chain-link fence, and into the heart of Willowbrook Nature Reserve. Bella's head snapped up. She had heard that cry before, not the exact sound, but the feeling behind it. The desperate call of a young one in pain. Bella began moving toward the sound, her cub scrambling to keep up. She had never approached the human den before, but tonight was different. Tonight, something was pulling her forward with a force she couldn't resist. Grace tried everything to calm Luna. She sang lullabies, offered water, checked if the bandages were too tight. Nothing worked. The little girl's cries grew louder, more desperate. Patricia appeared in the doorway, concerned. "Sometimes the pain medication wears off unevenly," she explained, preparing a syringe. "This should help her rest." But before Patricia could administer the medication, Luna's cries suddenly stopped. Not gradually, but all at once, as if someone had flipped a switch. Both women looked at the child in surprise. Luna was sitting up in bed, staring intently at the window. "What is it, baby?" Grace whispered, following her daughter's gaze. Outside, barely visible in the security lighting, A large, dark shape moved along the fence line. Patricia noticed it too and stepped closer to the window. "That's odd," she murmured. "The preserve is usually so quiet at night." Luna pressed her face against the glass, her small hand leaving a print on the cool surface. The dark shape stopped moving and seemed to be looking directly back at her. Bella had found the source of the crying. The human cub was 3 levels up, behind glass, but Bella could see her clearly. More importantly, she could feel her pain. It was the same feeling she had when her own cub was hurt or frightened. A deep, aching need to make things better. The bear began to pace along the fence, her eyes never leaving the window where Luna watched. Her cub sat nearby, confused by his mother's strange behavior, but trusting her completely. Inside the hospital, Luna had stopped crying entirely. She was fascinated by the large animal below, pointing excitedly and babbling in her toddler language. "Mama, big doggy," Luna said, her first words since the accident. Grace felt a chill run down her spine. That was no dog. She reached for the call button to alert security, but Luna grabbed her wrist with surprising strength. "No, Mama, nice doggy hurt too." Patricia and Grace exchanged glances. How could a 2-year-old know the bear was also in pain? But as they watched, they could see something was wrong with the animal's movements. She was favoring her left front paw, limping slightly as she walked. "She's injured," Patricia whispered. "That's probably why she's not retreating into the forest." What they didn't realize was that Bella's injury was old, a thorn that had been bothering her for weeks. But tonight, seeing the human cub in distress, her own pain seemed secondary. All that mattered was the overwhelming urge to help. Bella approached the building. The fence was high but not impossible for a determined bear. She had climbed higher trees searching for food, but something held her back. This was not her territory. These were not her kind. Still, the crying had stopped when she appeared. The connection between her and the small human was undeniable. Luna fell asleep again, but this time peacefully. Bella remained by the fence, a guardian in the darkness. The night shift staff began to notice the unusual visitor, but none of them felt threatened. The bear's posture was protective, not aggressive. Dr. Sarah Chen, the attending pediatrician, arrived for her early morning rounds at 5 a.m. Patricia met her at the elevator with an unusual report. "We have a situation in room 312, she began, struggling to find the right words. "There's a bear outside and somehow it's connected to our little burn patient." Dr. Chen raised an eyebrow. In 15 years of practice, she had never heard anything quite like this. But when she looked out the window of room 312, she saw exactly what Patricia meant. The bear was still there, now lying down but alert, watching the window where Luna slept. The cub was curled up beside her. It was the most peaceful scene Dr. Chen had ever witnessed involving a wild animal so close to a hospital. Luna woke up just as the sun began to rise. Her first action was to look out the window, and when she saw Bella still there, she clapped her hands with joy. Doggy stayed. Doggy stayed. Grace had barely slept, torn between fascination and fear. David had returned from his coffee run to find his wife and daughter transfixed by their unusual visitor. "We should call animal control," he said quietly. "No," Luna said firmly, the strongest word she knew. "Doggy help Luna. Doggy hurt too, help Doggy." It was then that Dr. Chen noticed something remarkable. Luna's burn, which should have been causing significant pain this morning, seemed to be bothering her less. The little girl was more alert, more engaged than any child should be after such a traumatic injury and sleepless night. "This is impossible, Doctor," Chen murmured, checking Luna's vitals. Her pain response is completely different from what I would expect. Outside, Bella sensed the increased activity in the room. More humans had arrived, and they seemed agitated. She stood up, protective instincts kicking in. Her cub stayed close, sensing his mother's tension. That's when Bella noticed something that changed everything. The building had a service entrance at ground level, and the door was propped open. A maintenance worker was wheeling in supplies, unaware of the bear watching from just 50 feet away. Bella had spent her entire life avoiding human structures, but now she faced a choice: stay outside and watch helplessly, or find a way to help the crying cub she had been guarding all night. The maternal bond that transcended species made the decision for her. Bella began walking toward the open door. The maintenance worker, Jake Thompson, had been working the night shift at Riverside General Hospital for 12 years. He had seen everything from midnight medical emergencies to confused elderly patients wandering the halls, but he had never seen a 400-pound black bear casually strolling toward the service entrance while he unloaded ice machines from his cart. Jake froze completely, his hand still gripping the handle of the wheeled cooler. The bear moved with purpose, not the frantic energy of a panicked animal, but with the deliberate steps of someone who knew exactly where they needed to be. Her cub followed close behind, occasionally looking back toward the forest, as if unsure about leaving their natural habitat. "Holy," Jake whispered, then caught himself. He had two choices: run and possibly startle the bear into aggressive behavior, or stay perfectly still and hope she passed by without noticing him. Bella did notice him, but Jake wasn't her concern. She could smell his fear, sharp and bitter in the cool morning air, but she also sensed something else. This human wasn't a threat. He was just as confused as she was about what was happening. The bear paused at the entrance, her massive head tilting as she listened to the sounds from inside the building. Somewhere above, she could still sense the presence of the injured cub she had been watching. The pull was stronger now, more urgent. Jake watched in amazement as Bella sniffed the air around the doorway, then carefully stepped inside. Her cub hesitated for a moment before following his mother into the strange world of fluorescent lights and linoleum floors. 3 floors above, Luna suddenly sat up in her hospital bed, startling Grace, who had just begun to doze off in the uncomfortable chair. "Doggy coming," Luna announced with the certainty that only very young children possess. "Doggy coming, help Luna." Grace looked out the window, but the area where the bear had been resting was now empty. A wave of panic washed over her. If the bear was no longer outside, where had it gone? "Patricia," Grace called out, her voice tight with worry. The nurse appeared quickly, took one look at the empty area outside the window, and immediately reached for her radio. "Security, this is Patricia on the 3rd floor. We have a situation. The bear that was outside has disappeared from view." Meanwhile, in the basement level of the hospital, Bella was discovering that human buildings were far more confusing than forest trails. The hallways branched in multiple directions, filled with strange smells and sounds that made her ears twitch nervously. Her cub stayed pressed against her side, overwhelmed by the alien environment. The bear's acute sense of smell was both helpful and problematic. She could detect traces of the injured cub she was seeking, but the scent was mixed with hundreds of other human smells, cleaning chemicals and medical odors that made her nose burn. Dr. Chen had just finished examining Luna when the security alert came through the hospital's communication system. "All staff, please be advised that a large bear has potentially entered the building. Do not approach. Remain in secure areas until further notice." "What does that mean?" David asked, his voice rising with concern. Before Dr. Chen could answer, Luna clapped her hands together excitedly. "Doggy here! Doggy coming!" Grace grabbed her daughter's uninjured hand. How can she possibly know that? Dr. Chen had been asking herself the same question. In her years of medical practice, she had seen some unusual cases, but nothing had prepared her for a 2-year-old who seemed to have some kind of psychic connection with a wild bear. Down in the basement, Bella had found the service elevator. The metal doors reflected her image back at her, and for a moment she studied the unfamiliar sight of herself in this strange place. Her cub whimpered softly, clearly wanting to return to the forest, but Bella's maternal instincts overrode everything else. The elevator doors were closed, but Bella could hear the mechanical sounds from inside the shaft. She had seen the maintenance worker use a small plastic card to make doors open elsewhere in the building. But she had no such card, and her paws were not designed for human technology. That's when she heard something that made her heart race. From somewhere above, carried through the building's ventilation system, came the faint sound of crying. It wasn't the same desperate wailing from the night before, but softer, more like whimpering. The injured cub was in distress again. Bella began to pace in front of the elevator, her anxiety building. She had come this far, but now she was trapped by human inventions she couldn't understand or operate. Jake Thompson, who had been frozen in shock for several minutes, finally found his voice. He had followed the bear and her cub at a safe distance, curiosity overcoming his fear. Now he watched as the animal showed clear signs of frustration and distress. "What do you want?" he whispered to himself. Then immediately felt foolish for asking a question to a bear. But as if Bella had somehow understood him, she stopped pacing and looked directly at Jake. Her dark eyes held an intelligence that made him take a step back. Then she did something that would haunt Jake's dreams for months afterward. She walked over to the elevator call button and touched it with her nose, then looked back at Jake expectantly. Jake's hands were shaking as he pulled out his maintenance keycard. "This is crazy," he muttered. "This is absolutely insane." But something in the bear's expression compelled him to swipe the card and press the up button. The elevator arrived with a soft ding, and the doors slid open. Bella examined the small metal box, clearly hesitant to enter such a confined space. Her cub was even more reluctant, pressing himself against the wall. On the 3rd floor, Luna's condition had taken a puzzling turn. Her heart rate had increased, but not in a way that suggested pain or fever. Instead, she seemed excited, almost euphoric. "Something's happening," she told her parents, her vocabulary surprisingly advanced for the moment. "Doggy scared. Need help, doggy." Patricia had seen children say remarkable things during medical crises, but Luna's behavior was beyond anything in her experience. The little girl seemed to be narrating events that were happening elsewhere in the building. "The security team is searching for the bear," Dr. Chen explained to Grace and David. "They'll find it and safely remove it from the building." "No!" Luna's voice was sharp with distress. "No hurt doggy. Doggy help Luna. Luna help doggy." The little girl tried to climb out of her hospital bed, but Grace gently held her back. "Sweetheart, you need to stay here. You're hurt, remember?" Luna looked at her bandaged arm as if seeing it for the first time that morning. "Not hurt bad. Doggy make better." She paused, tilting her head as if listening to something only she could hear. Doggy in small room. Doggy scared of small room. Grace felt chills run down her spine. There was no way Luna could know that the bear was currently standing in front of an elevator, terrified of entering the enclosed space. But that's exactly what was happening 3 floors below. Bella had been staring into the elevator for several minutes, every instinct telling her that small, enclosed spaces were dangerous. In the wild, getting trapped meant death. But the crying sounds from above were getting stronger, more urgent. Her cub solved the dilemma by walking into the elevator first. If his mother was going into this strange metal den, then he would go too. Bella couldn't let her baby face danger alone. She stepped into the elevator, filling most of the available space. Jake realized he would have to squeeze in with them or send them up alone. The thought of a confused bear wandering the hospital floors without any human guidance made his decision for him. "Okay, here goes nothing," he whispered, stepping into the elevator with the two bears. The ride to the third floor was the longest 30 seconds of Jake's life. Bella stood perfectly still, but he could feel her tension radiating through the small space. Her cub had positioned himself between his mother and Jake, protective despite his youth. When the elevator stopped and the doors opened, they were greeted by chaos. The third-floor nursing station was in full emergency mode. Security guards with tranquilizer equipment were positioned at various points along the hallway. Hospital staff had been moved to secure areas, and patients had been relocated away from the area where the bear was expected to appear. What no one had expected was for the bear to arrive via elevator with a maintenance worker as an escort. "Don't shoot!" Jake yelled as soon as he saw the security team. "She's not aggressive. There's something else going on here." But Bella wasn't paying attention to the humans with their strange weapons. She had found what she was looking for. Down the hallway, behind a door marked 312, she could sense the injured cub more clearly than ever. She began walking toward room 312, ignoring the shouts and commotion around her. Her cub stayed close, but his attention was caught by something else entirely. There was another scent in the hallway, one that made his young nose twitch with interest. It was coming from room 308, and it smelled like another injured animal. The cub veered away from his mother, drawn by instincts he didn't yet understand. In room 308, 8-year-old Marcus Williams lay sleeping. He had been in the hospital for 3 days, recovering from surgery to repair a broken leg suffered in a bicycle accident. His parents had gone home for a few hours of rest, leaving Marcus alone with his favorite comic books and a stuffed tiger named Stripes. Marcus woke up when he heard the commotion in the hallway. Through his slightly open door, he caught a glimpse of something that made him rub his eyes in disbelief. A bear cub, about the size of a medium dog, was sniffing around his doorway. Marcus had always loved animals. His bedroom at home was filled with nature documentaries, animal encyclopedias, and stuffed versions of every creature he had ever learned about. But he had never been this close to a real wild animal before. "Hey there, little guy," Marcus whispered, not wanting to startle the cub. The young bear looked up at the sound of his voice. Unlike his mother, the cub had no specific mission driving him. He was simply curious about this place, filled with interesting smells and sounds. Marcus slowly extended his hand, the way his father had taught him to approach unfamiliar dogs. The cub sniffed his fingers, then surprised Marcus by gently licking them with a rough, warm tongue. "You're just a baby, aren't you?" Marcus said softly. "Are you looking for your mom?" Down the hallway, Bella had reached room 312. The door was closed, but she could hear voices inside, and more importantly, she could sense the injured cub's distress more clearly than ever. Inside the room, Luna was becoming increasingly agitated. "Doggy here, doggy outside door," she kept repeating, pointing toward the hallway. Grace looked at David with growing concern. "This is impossible. How can she know these things?" Dr. Chen was asking herself the same question, but from a medical perspective. She had seen cases where trauma created temporary psychic sensitivity in children, but never anything this specific or consistent. Should we open the door?" Patricia asked hesitantly. Before anyone could answer, they heard a soft scratching sound. Something was gently pawing at the door from the outside. Luna's face lit up with joy. Doggy knocking. Doggy polite. In the hallway, Security Chief Robert Manning was facing the most unusual situation of his 20-year career. The bear was showing no signs of aggression, but she was clearly determined to reach room 312. Every time his team tried to position themselves between the bear and the door, she would simply wait patiently for them to move, then continue toward her goal. "Sir," one of his officers radioed, "this doesn't feel like a normal wild animal situation. She's acting almost rational." Manning had to agree. In his experience, bears that entered buildings were either sick, injured, or desperately searching for food. This bear seemed to be on a specific mission. "Hold positions, but don't engage unless she becomes aggressive," Manning ordered. Inside room 312, the scratching at the door continued. Luna had managed to climb out of her bed, despite her parents' protests, and was now standing as close to the door as Grace would allow. "Open door, Mama. Doggy need help, Luna. Luna need help, Doggy." Dr. Chen found herself in an impossible situation. Every medical protocol told her to keep her patient safe from a wild animal, but every instinct told her that something extraordinary was happening, something that defied normal medical understanding. "What if," she began slowly, "what if we opened the door just a crack, with security right there?" David shook his head vigorously. "Absolutely not. I'm not putting my daughter at risk for some kind of whatever this is." But Grace was looking at Luna's face, seeing an expression she had never seen before. Her daughter looked peaceful, confident, almost wise beyond her years. "David," Grace said quietly, "what if Luna is right? What if this bear really is trying to help her somehow?" Before David could respond, they heard a new sound from the hallway. It was Jake Thompson's voice, and he was talking to someone. "I know this sounds crazy," Jake was saying, presumably to the security team, "but I think she's trying to help the kid in that room. She's been gentle this whole time. She even waited for me to call the elevator for her." Dr. Chen made a decision that would either be remembered as inspired or career-ending. She walked to the door and slowly turned the handle. The door opened to reveal Bella sitting calmly in the hallway, her massive form somehow managing to look patient and non-threatening despite her size. Behind her, security guards stood ready with tranquilizer guns, but their weapons remained lowered. When Bella saw Luna, something remarkable happened. The bear's entire demeanor changed. Her eyes softened, and she made a low, gentle rumbling sound that was clearly meant to be comforting. Luna responded by clapping her hands and making happy, babbling sounds. "Doggy!" Luna exclaimed. "Pretty doggy." "Hurt paw?" Grace gasped. She hadn't noticed it before, but the bear was indeed favoring her left front paw, just as Luna had somehow known. Bella slowly stood up and took one careful step toward the room. Every human in the hallway tensed, but the bear's movements were deliberate and non-threatening. That's when they heard Marcus calling from down the hall. Hey, there's a baby bear in my room and I think he's lost." The announcement from Marcus sent a ripple of panic through the security team. Chief Manning quickly radioed his officers. "We have a second bear. Repeat, second bear located in room 308. Do not engage. Maintain visual contact only." Bella's head snapped toward the sound of Marcus's voice. Her maternal instincts kicked into overdrive when she realized her cub was no longer behind her. She let out a low, worried grunt that somehow conveyed both concern and reassurance to everyone present. Luna, still standing near the doorway, looked directly at Bella and said something that made every adult in the vicinity freeze. "Baby bear okay. Boy with hurt leg taking care. Boy lonely too." Dr. Chen felt the world tilt slightly on its axis. There was absolutely no way Luna could know that Marcus was in room 308, that he had a broken leg, or that he had been feeling isolated during his hospital stay. Yet her words carried the ring of absolute truth. Grace reached out and touched her daughter's forehead, checking for fever. "Sweetheart, how do you know about a boy?" Luna looked at her mother with the patient expression children sometimes wear when adults ask obvious questions. "Luna, no. Doggy mama, no. Baby bear tell boy stories. Boy tell baby bear stories. Not lonely now." Down the hall in room 308, Marcus was indeed no longer lonely. The bear cub had settled beside his bed, showing remarkable gentleness around the boy's elevated cast leg. Marcus had been reading to the cub from one of his comic books, and somehow the young animal seemed to be listening intently. "You're really smart, aren't you?" Marcus whispered to the cub. "I bet you understand more than people think animals can understand." The cub responded by placing one small paw very carefully on Marcus's arm, avoiding the IV line with an awareness that seemed almost human. Back in the hallway, Bella was torn between two powerful instincts. She needed to reunite with her cub, but she also felt an overwhelming compulsion to help the injured human cub who had been calling to her all night. The conflict was visible in her body language as she shifted weight from foot to foot. Jake Thompson, who had remained surprisingly calm throughout the entire situation, found himself becoming an unofficial translator between the bears and the humans. "She wants to check on her baby," he told the security team, "but she also doesn't want to leave this little girl. Look at how she keeps looking back and forth." Chief Manning had seen many unusual situations in his career, but nothing had prepared him for negotiating with a wild animal who seemed to understand complex emotional dynamics. He made a decision that went against every protocol in his manual. "Let's bring the boy and the cub here," he said into his radio. "If they're all together, maybe we can resolve this peacefully." Dr. Chen overheard the plan and immediately protested. "You can't move Marcus. His leg needs to remain elevated, and moving him could cause complications." "Then we bring his bed," Manning replied. "These animals aren't acting aggressively. Maybe there's something we don't understand happening here." Nurse Patricia, who had been silently observing the entire situation, suddenly spoke up. "I've worked pediatrics for 30 years, and I've seen children form attachments to therapy animals. But this is different. It's like they're communicating on a level we can't access." Meanwhile, in room 308, Marcus had made a discovery that would change everything. While reading to the bear cub, he had noticed something odd about the animal's behavior. The cub kept pawing at a specific spot on his own fur, just behind his left ear. "What's wrong, little guy?" Marcus asked, gently examining the area the cub kept indicating. Hidden beneath the thick fur, Marcus found something that made his heart race. It was a small, infected wound, probably from a thorn or sharp branch. The infection was spreading, causing the cub pain and potentially threatening his life. "Oh no," Marcus whispered. "You're sick, aren't you? That's why your mom brought you here. She knew you needed help." The realization hit Marcus like a thunderbolt. This wasn't just about Luna's burn injury. The mother bear had brought her sick cub to the one place where both young ones could receive the help they needed. Marcus immediately pressed his call button, his voice urgent when Patricia answered. "I need a doctor right away. The baby bear is sick. He has an infection." His announcement was overheard through the intercom system, reaching everyone in the hallway outside room 312. Luna's reaction was immediate and heartbreaking. She began crying, not the frustrated wails of a hurt toddler, but deep, empathetic sobs that seemed to echo the mother bear's distress. "Baby bear hurting bad," Luna said through her tears. "Mama bear so scared, brought baby to help her humans." Bella, hearing Luna's cries, made a decision that demonstrated intelligence beyond what anyone thought possible in a wild animal. She walked to the wall-mounted emergency phone outside room 312 and knocked it off its cradle with her nose. The phone clattered to the floor, its receiver dangling, but the automated emergency system activated. "Emergency services, how can we help you?" The voice crackled through the speaker. Before anyone could respond, Bella did something that would be talked about in medical journals for years to come. She let out a series of specific vocalizations, not random bare sounds, but what seemed to be deliberately varied tones and rhythms. Luna stopped crying and listened intently. Then she walked to the fallen phone receiver. "Baby bear, very sick," she said clearly into the phone. "Need animal doctor, please help baby bear." The emergency operator, trained to handle all kinds of crisis calls, had never received a request for veterinary assistance from a 2-year-old translating for a bear. But something in Luna's voice conveyed absolute urgency. "I'm dispatching veterinary emergency services to your location," the operator responded professionally. "They'll be there in 15 minutes. Dr. Chen stared at Luna in amazement. "How did you know to ask for a veterinarian? How did you even know what a veterinarian was?" Luna looked up at Dr. Chen with eyes that seemed far older than her 2 years. "Mama Bear showed Luna, in dreams last night. Mama Bear very smart, no human helpers fix hurt babies." The pieces of the puzzle were beginning to form a picture that challenged everything the adults thought they knew about animal intelligence and interspecies communication. Grace found her voice first. Are you saying this bear planned this? That she brought her sick cub to the hospital on purpose?" Before Luna could answer, they heard the sound of wheels in the hallway. The nursing staff was carefully moving Marcus's hospital bed, with the bear cub still curled up beside him. "He won't leave the boy," reported Nurse Jennifer, who was helping guide the bed. "And the boy refuses to let us separate them. Says the cub is too scared to be alone." When Marcus's bed reached the area outside room 312, an extraordinary scene unfolded. The mother bear and her cub were reunited, but instead of immediately leaving with her baby, Bella divided her attention between both children. She approached Luna first, extending her massive head toward the little girl. Luna, showing no fear whatsoever, gently patted the bear's nose. "Good mama," Luna said softly. "Luna understand now. Mama Bear love baby bear like Luna mama love Luna." Then Bella moved to Marcus, sniffing carefully around his broken leg. She seemed to recognize that he was also injured and needed gentle treatment. Marcus looked up at the enormous bear with wonder rather than fear. "Your baby is going to be okay," he told her. "The animal doctors are coming to help him." Dr. Chen was documenting everything, knowing that this case would require detailed medical records that no one would believe without multiple witnesses. That's when Luna said something that changed the entire dynamic of the situation. "Mama Bear and Luna Mama should be friends. Both mamas take care of hurt babies. Both mamas love babies very much." Grace looked at the massive bear, seeing her not as a wild predator but as another mother doing everything possible to help her child. The recognition was mutual. Bella looked at Grace with what could only be described as understanding and respect. The veterinary emergency team arrived exactly 15 minutes later, led by Dr. Amanda Rivers, an exotic animal specialist who had treated everything from zoo animals to wildlife rescues. She had been briefed on the unusual circumstances during her drive to the hospital, but seeing the situation firsthand still left her speechless. "In 20 years of veterinary practice," Dr. Rivers said quietly, "I have never seen wild animals seek out human medical help. This is unprecedented." She began examining the bear cub while Bella watched anxiously. Marcus held the cub's paw during the examination, providing comfort to the frightened animal. "The infection is serious but treatable," Dr. Rivers announced. "A few days of antibiotics and proper wound care and he'll be fine." But how did a wild bear know to bring him to a hospital? Luna, who had been quietly observing the examination, provided an answer that sent chills through everyone present. Mama Bear watched human families before, saw cars bring hurt babies to big white building, saw hurt babies come out better. Mama Bear, very smart, learned human helper place. The implications of Luna's statement were staggering. It suggested that Bella had been observing human behavior for possibly months or years, learning about hospital function and planning for a medical emergency involving her cub. Jake Thompson, who had become an unofficial part of the medical team, shook his head in amazement. "She's been studying us, learning how our world works so she could access our help when she needed it." But the most remarkable moment was yet to come. As Dr. Rivers prepared to treat the bear cub's infection, she realized she would need to sedate the young animal to properly clean and dress the wound. When she explained this to the room, both children became distressed. "Baby bear scared of sleep medicine," Luna said with certainty. Marcus nodded in agreement. "He's been trying to tell me he's afraid of going to sleep. I think something bad happened to him when he was unconscious before." Dr. Rivers paused, considering the children's input. In veterinary medicine, animal behavior cues were crucial for successful treatment, but she had never received those cues through human children acting as interpreters. "What if we try a local anesthetic instead?" she suggested. "It won't put him to sleep, just numb the area." The moment Dr. Rivers made this adjustment to her treatment plan, both the mother bear and cub visibly relaxed. Bella moved closer to the examination area, positioning herself where her cub could see her throughout the procedure. During the treatment, something magical happened. Luna began humming a simple lullaby, the same one Grace had sung to her during her own medical treatment. Marcus joined in, his voice harmonizing with Luna's. The bear cub, despite being in an alien environment surrounded by strangers, remained calm throughout the entire procedure. He seemed to draw comfort not just from his mother's presence but from the children's song. When Dr. Rivers finished treating the infection, she made an announcement that surprised everyone. "I recommend keeping the cub under observation for 24 hours to ensure the antibiotic treatment is effective. But given the unique circumstances, I think the best place for that observation might be right here with his mother and these children." Chief Manning found himself nodding in agreement, despite every regulation he could think of. "We'll set up a secure area. This situation is beyond normal protocols anyway." But Luna had one more surprise for everyone. "Mama Bear wants to help Luna too," she announced. "Mama Bear knows special healing from forest medicine." Grace looked at her daughter skeptically. "What do you mean, sweetheart?" Luna pointed to Bella, who had moved to a corner of the hallway where a maintenance cart sat forgotten. The bear began carefully examining the various supplies on the cart, her nose working to identify different scents. Finally, Bella selected a small container of aloe vera gel that was part of the cleaning supplies. She brought it to Dr. Chen, setting it down at the doctor's feet. Dr. Chen picked up the container, reading the label. This is actually perfect for burn treatment. Aloe vera has natural healing properties that complement the standard burn care protocol." "How could she know that?" David asked, his voice filled with wonder. Luna clapped her hands happily. "Forest bears know plant medicine. Mama Bear shared knowledge with Luna in dreams." Dr. Rivers, who had been quietly observing this exchange, made a statement that would later be quoted in medical journals around the world. I think we're witnessing the first documented case of interspecies medical collaboration. These animals aren't just seeking our help, they're offering their own knowledge in return. As the day progressed, an unprecedented partnership developed between the medical staff, the children, and the bears. Luna's burn was treated with a combination of modern medicine and the aloe vera gel that Bella had identified. Marcus provided emotional support to the bear cub during his recovery, and Bella served as a calming presence for both children, somehow understanding exactly how to comfort human young in distress. But the most extraordinary discovery was still to come. Dr. Chen noticed that Luna's pain levels were significantly lower when Bella was nearby. Similarly, Marcus's anxiety about his own recovery seemed to vanish when he was caring for the bear cub. There's something happening here that medical science doesn't have a name for yet, Dr. Chen told her colleagues during an impromptu meeting. Both children are showing accelerated healing responses that coincide directly with their interaction with these animals. The story began spreading throughout the hospital. Staff members found excuses to walk past the unusual gathering. Patients in nearby rooms asked to be moved closer so they could witness the remarkable scene. By evening, something unprecedented had occurred. The hospital had inadvertently become the site of the first successful integration of wildlife medicine and human pediatric care. But as night fell, everyone knew they faced a crucial decision. The bears couldn't stay in the hospital indefinitely, and yet separating them from the children seemed to be causing distress for everyone involved. Luna provided the answer in the way that had become her trademark, with simple wisdom that cut through complex adult reasoning. "Mama Bear and Baby Bear not stay in People House," she said, "but friends now, friends visit, friends help when needed." Grace looked at her daughter with tears in her eyes. Somehow, in the space of less than 24 hours, Luna had not only recovered from her traumatic burn injury, but had also facilitated what might be the most important medical breakthrough in decades. Dr. Rivers approached Bella one final time before the bears would return to the forest. She wanted to apply one more dose of antibiotic ointment to the cub's wound. What happened next would be remembered by everyone present for the rest of their lives. Bella carefully picked up the tube of ointment in her teeth and walked to Luna's bedside. She gently set the tube down where the little girl could reach it. Luna understood immediately. She carefully applied a small amount of the ointment to her own burn, then handed the tube back to Bella. The mother bear then applied the medication to her cub's wound with a precision that astounded the medical professionals watching. "She learned our treatment protocol," Dr. Chen whispered. "She's going to continue the medical care in the wild." As the bears prepared to leave, Luna made one final request. "Tomorrow, Luna go to window. Say hello to forest friends." Bella seemed to understand. She touched Luna's hand gently with her nose, then did the same with Marcus. The mother bear and her cub walked to the elevator, where Jake Thompson was waiting to escort them safely out of the building. But before the elevator doors closed, Bella looked back at the children one last time. In that look was a promise that the bond formed between species in this remarkable 24 hours would continue, and that healing sometimes comes from the most unexpected sources. The elevator doors closed, taking the bears back to their forest home, but the impact of their visit would resonate through the medical community for years to come. However, the story was far from over. That night, as Luna slept peacefully for the first time since her accident, Grace sat by her daughter's bedside reflecting on everything that had happened. Through the window, she could see the edge of Willowbrook Nature Reserve, and she could swear she saw two familiar shapes moving among the trees. Dr. Chen entered the room with Luna's latest test results, her expression a mixture of excitement and bewilderment. "Grace, I need to show you something extraordinary," she said, holding up the medical charts. Luna's burn is healing at 3 times the normal rate. The tissue regeneration is unlike anything I've seen in 20 years of medicine. Grace looked at the reports, then back toward the forest. Is it because of the bears, somehow? I don't know, Doctor, Jen admitted. But I do know that we've documented something that could change how we approach pediatric medicine. The emotional and psychological healing that occurred today seemed to accelerate the physical healing process. Down the hall, Marcus was experiencing similar results. His bone scan showed accelerated healing, and his pain levels had dropped dramatically. When his parents arrived the next morning, they found their son sitting up in bed, animatedly telling stories to a nurse about his bear friend. "Mom, Dad," Marcus called out when he saw them. "You're not going to believe what happened. I helped save a baby bear's life, and he helped me feel better too." His parents listened in amazement as Marcus recounted the previous day's events. The story seemed impossible, but the evidence was undeniable. Their son was dramatically improved both physically and emotionally. News of the extraordinary events at Riverside General Hospital began to spread beyond the medical community. Animal behaviorists, child psychologists, and researchers from around the world reached out to learn more about the unprecedented interspecies healing that had occurred. But for Luna, Marcus, Grace, David, and all the hospital staff who witnessed it, the most important aspect wasn't the scientific implications. It was the simple, profound truth that healing comes in many forms, and sometimes the most powerful medicine is the recognition that all mothers, human and animal alike, will do anything to help their children. 3 days later, Luna was released from the hospital with minimal scarring and no sign of infection. Marcus was ahead of schedule for his leg recovery and was expected to be walking normally within weeks rather than months. As Grace packed Luna's belongings, her daughter made one final observation that would stay with her forever. Mama Bear taught Luna that love is the best medicine, and sharing love makes everyone stronger. Looking back toward the forest preserve as they left the hospital, Grace whispered a thank you to Bella, wherever she might be. And in the depths of Willowbrook Nature Reserve, a mother bear and her healthy cub paused in their foraging to look toward the hospital building, as if they too remembered the extraordinary bond that had formed between species and the healing power of unexpected friendships. But the story that had captivated the world was about to take an even more remarkable turn. 2 weeks after Luna's discharge from the hospital, Grace received a phone call that would change their lives forever. It was Dr. Elena Vasquez, a renowned animal behaviorist from the International Wildlife Research Institute. "Mrs. Martinez," Dr. Vasquez said, her voice filled with excitement. "I've been studying the reports from Riverside General Hospital. What happened with your daughter and the bears represents a breakthrough in our understanding of interspecies communication. I'd like to request permission to conduct a follow-up study." Grace hesitated. Luna had been doing wonderfully since leaving the hospital. Her burn had healed completely, leaving only the faintest mark that doctors said would disappear entirely within a year. More importantly, Luna seemed to have developed an unusual confidence and emotional maturity that amazed everyone who knew her. "What kind of study?" Grace asked. "We want to understand if the connection between Luna and the bear family is ongoing," Dr. Vasquez explained. "Our preliminary research suggests that what happened at the hospital may have established a permanent communication link between your daughter and the local wildlife." Grace glanced toward Luna, who was playing in their backyard. Their house bordered the Willowbrook Nature Reserve, and Grace had noticed that Luna often stood at the fence, seeming to listen to sounds from the forest that no one else could hear. "Has Luna mentioned the bears since you've been home?" Dr. Vasquez asked. "Every day," Grace admitted. "She insists they're talking to her, telling her about forest life." She's started drawing pictures of animals I'm sure she's never seen before, and when I ask her about them, she says Bella taught her. Dr. Vasquez's intake of breath was audible. Mrs. Martinez, this could be the first documented case of sustained telepathic communication between humans and wildlife. Would you be willing to bring Luna to the reserve for some controlled observations? 3 days later, Grace found herself walking through Willowbrook Nature Reserve with Luna, Dr. Vasquez, and a team of researchers equipped with cameras, audio equipment, and monitoring devices. Luna had been excited about the trip since the moment Grace told her about it. "We're going to see Bella," Luna had announced with absolute certainty. "She's been waiting for us." The research team had set up their equipment in a clearing about half a mile from the hospital. Dr. Vasquez explained that this area had been identified through tracking collars as the bear's primary territory. "Now, Luna," Dr. Vasquez said gently, "we're going to wait quietly and see if your bear friends appear. Don't worry if nothing happens. Sometimes animals need time to feel comfortable." Luna looked at Dr. Vasquez with the patient expression she wore when adults said things she knew weren't quite right. "Bella coming now," Luna said matter-of-factly. "She bringing surprise." Within minutes, the research team heard rustling in the underbrush. Dr. Vasquez signaled for everyone to remain perfectly still as Bella emerged from the forest, her cub close behind. But they weren't alone. Following behind them was another bear family, a father bear and 2 older cubs, probably yearlings from the previous season. Then another family appeared, and another, until 7 bears in total had gathered in the clearing. Dr. Vasquez had never seen anything like it. Bears were typically solitary animals except during mating season or when mothers were with their young cubs. To see multiple families gathering together was unprecedented. Luna clapped her hands with delight. "Bella brought family. All bears want to meet Luna." The little girl began walking toward the group of bears, causing several researchers to reach for their emergency equipment. But Grace, somehow understanding that this was safe, held up her hand to stop them. Luna approached Bella first, greeting her like an old friend. The massive bear lowered her head so Luna could pat her nose, just as she had done in the hospital. Then something extraordinary happened. Luna began speaking to the bears in a mixture of her normal toddler language and sounds that mimicked bear vocalizations. The bears responded with their own grunts, huffs, and rumbles that seemed to follow conversational patterns. Dr. Vasquez whispered into her recording equipment, "Subject appears to be engaging in complex communication with multiple ursine subjects. Communication includes both verbal and gestural elements suggesting structured dialogue." But the most remarkable discovery was yet to come. One of the older cubs approached Luna carrying something in his mouth. It was a small bundle of plants, herbs that Dr. Vasquez immediately recognized as having medicinal properties. "Luna," Grace called softly, "what is the bear giving you?" Luna examined the plants carefully. "Medicine for Marcus," she said. "Bear friends know Marcus' legs still hurt sometimes. These plants make pain go away." Grace felt chills run down her spine. Marcus had indeed been experiencing occasional pain in his leg, something only his family and medical team knew about. How could Luna possibly know this, and how could the bears have known to bring specific plants for his condition? Dr. Vasquez was documenting everything, her excitement barely contained. "Luna, can you ask the bears how they knew about Marcus?" Luna turned back to the bears and made several sounds that were clearly not human language. Bella responded with a series of grunts and gestures. "Bella says bear families watch hospital from forest," Luna translated. "See hurt humans come and go. Learn which plants help which herds. Want to help human families like human families helped bear family. The implications were staggering. It suggested that the bear population had been systematically observing human medical practices and developing their own understanding of healing. But the bears had more to share. Another adult bear approached Luna with what appeared to be a small piece of bark. Luna examined it carefully. Then her eyes widened with understanding. "This medicine for Luna, friend at hospital," she announced. "Little girl with sad heart." Grace looked confused. "What little girl, sweetheart?" "Sophie," Luna said with certainty. "She has sick blood. Very sad. This bark helped make blood strong again." Dr. Vasquez immediately contacted Dr. Chen at the hospital. After a brief conversation, she turned to Grace with amazement. "There is a child named Sophie currently in the pediatric ward," she said quietly. "She's receiving treatment for leukemia. How could Luna possibly know about her?" Luna overheard the conversation and provided an answer that left everyone speechless. "Bear friends watch all hurt children. Send healing thoughts through forest wind. Luna hear messages, pass to humans." Dr. Vasquez realized they were witnessing something that challenged fundamental assumptions about animal intelligence and communication. The bears appeared to have developed a sophisticated understanding of human medicine and were actively working to help heal human children. Over the next hour, the bears continued to present various plants and natural remedies, with Luna providing explanations for their uses. Each item corresponded to specific medical conditions affecting children currently in the hospital. But the most emotional moment came when Bella's own cub approached Luna with a small flower that was clearly precious to him. Luna's expression became very serious as she listened to the cub's soft vocalizations. Tears began forming in her eyes. "What is it, Luna?" Grace asked, moving closer to her daughter. "Baby bear wants to give flower to Doctor Chen," Luna said softly. "Say thank you for saving his life." Flower very special, means friend forever in bear language. The research team watched in amazement as Luna carefully accepted the flower, treating it with the reverence of someone receiving a sacred gift. But the bears weren't finished with their surprises. The largest male bear, who had remained at the edge of the gathering, slowly approached Luna. In his mouth, he carried something that made Dr. Vasquez gasp. It was a small piece of crystalline mineral that glowed faintly in the afternoon sunlight. "Luna," Dr. Vasquez said carefully, "that appears to be a piece of quartz crystal. Bears don't typically collect minerals unless—" She trailed off, unwilling to voice what she was thinking. Luna accepted the crystal from the large bear and held it up to examine it closely. As she did, something incredible happened. The crystal began to glow more brightly, pulsing with a soft, warm light that seemed to respond to Luna's touch. "Magic healing stone," Luna said simply, "for humans who help animals. Makes healing faster and stronger." Dr. Vasquez found herself in the unprecedented situation of documenting what appeared to be either an unknown scientific phenomenon or something that transcended current scientific understanding. But the bears had one more revelation that would change everything. Bella moved to the center of the clearing and began a series of complex vocalizations that seemed to be directed at all the assembled bears. They responded in unison, creating a harmonious sound that was unlike anything the research team had ever heard. Luna listened intently, her expression growing more serious with each passing moment. "What are they saying, Luna?" Grace asked gently. Luna looked up at her mother with eyes that seemed far older than her 3 years. "Bear families making promise. Will always watch over human children. Will share forest medicine when needed. But humans must promise too." "What kind of promise?" Dr. Vasquez asked. Luna turned to address the entire research team. Must promise to protect forest home. Must promise to teach other humans that animals are friends, not afraid things. Must promise to listen when animals try to help. The weight of Luna's words settled over the group. They were being asked to serve as ambassadors between species, to facilitate a partnership that could benefit both humans and wildlife. Dr. Vasquez made a decision that would define the rest of her career. "We promise," she said solemnly. "We'll work to protect your forest home and teach others about the importance of listening to animals." The bears seemed to understand her words. They each approached Luna in turn, touching her gently with their noses in what was clearly a farewell ceremony. But as the bears began to disperse back into the forest, Bella had one final surprise. She led Luna to a specific tree at the edge of the clearing and began pawing at the base. Luna immediately understood and began digging in the soft earth with her small hands. What she uncovered made the entire research team lean forward in amazement. It was a small wooden box, clearly handmade but weathered with age. Inside the box were dozens of small items: unusual stones, pressed flowers, pieces of carved wood, and what appeared to be primitive drawings on bark. "What is this, Luna?" Grace asked in wonder. Luna examined the contents carefully. Messages from animal friends to humans. Very old messages. Animals try to talk to humans for long time. Humans forgot how to listen. Dr. Vasquez picked up one of the bark drawings. It showed crude but recognizable figures of humans and animals working together, sharing food, healing each other. "Luna," she said softly, "how long do you think animals have been trying to communicate with humans?" Luna looked at the collection of artifacts with the wisdom that had become her trademark. "Always," she said simply. "Animals always want to be friends. Humans just forgot how to hear friend talk." As they prepared to leave the clearing, Luna made one final request to the research team. "Tell Marcus about bear medicine. Tell Sophie about healing flower. Tell Dr. Chen about thank you gift. Animals want to help all hurt children." The walk back through the forest was quiet, each member of the research team processing what they had witnessed. Dr. Vasquez knew that documenting this experience would challenge every scientific journal's willingness to publish findings that bordered on the miraculous. But as they reached the edge of the preserve, Luna provided one more piece of information that would prove the reality of her connection with the wildlife. "Tomorrow, baby deer family need help," she announced matter-of-factly. "Mama deer hurt leg in trap. Need human helpers to fix trap hurt." Dr. Vasquez looked at Luna seriously. "Where, Luna? Where's the hurt deer?" Luna pointed toward a specific section of the forest. "By old stone wall, near water sound. Baby deer very scared, mama deer very brave, but need medicine help." The next morning, Dr. Vasquez and a wildlife rescue team found exactly what Luna had described. A mother deer with her two fawns, the mother's leg caught in an old wire snare that had been abandoned by poachers years earlier. The rescue was successful, and the deer family was relocated to a safe area of the preserve after receiving medical treatment. When Dr. Vasquez called Grace to report the successful rescue, Luna's response was typical of her new role as an interspecies communicator. "Good," Luna said when she heard the news. "Deer family very happy now. Say thank you to human helpers." But the events of the past month had attracted attention from far beyond the local medical and scientific communities. News outlets from around the world began reporting on the miracle child of Willowbrook and the unprecedented animal communication events surrounding her. Animal rights organizations, religious groups, and scientific institutions all wanted to study or meet Luna. Grace and David found themselves overwhelmed by requests for interviews, research opportunities, and public appearances. They had to make difficult decisions about how to protect their daughter, while also honoring the extraordinary gift she seemed to possess. The decision was made for them when Luna herself provided guidance. "Too many stranger humans want to see Luna," she told her parents one evening. "Makes animal friends nervous. Animal friends say Luna should choose careful who to trust." Grace realized that Luna's connection with the wildlife was giving her wisdom beyond her years. The animals were actually protecting her, helping her navigate the complex world of human attention and exploitation. Dr. Vasquez became Luna's primary advocate in the scientific community, carefully screening research requests and ensuring that any studies conducted were designed to benefit both Luna and the animal populations she communicated with. Marcus's family had also been contacted by researchers interested in studying his remarkable recovery and his role in the bear cub's healing. Marcus, now fully recovered and walking normally, had developed his own connection with local wildlife, though not as pronounced as Luna's. The two children became close friends, bonding over their shared experience and their mutual love of animals. Marcus often visited Luna's family, and together they would spend hours at the edge of the preserve, apparently communicating with various animals that approached the fence. Dr. Chen at the hospital had become an unexpected pioneer in what was being called zootherapeutic medicine, the integration of animal wisdom and behavior into human medical treatment. The flower that the bear cub had given Luna was analyzed and found to contain compounds that showed promise in treating childhood depression and anxiety. The crystalline mineral had properties that seemed to accelerate cellular healing, though scientists couldn't explain the mechanism. Most remarkably, the medicinal plants that the bears had provided for Marcus proved to be highly effective in treating the type of bone pain he had been experiencing. Traditional medicine had no explanation for why these specific plants would be beneficial for his condition. Sophie, the young leukemia patient Luna had mentioned, did indeed benefit from the bark remedy the bears had suggested. When properly prepared and administered under medical supervision, it showed significant positive effects on her white blood cell counts. The hospital began maintaining a detailed database of animal-suggested remedies, working with botanists and pharmacologists to understand the medicinal properties of plants identified by Luna's animal friends. But perhaps the most significant development was the change in Luna herself. As weeks passed, Luna began demonstrating abilities that extended far beyond communication with bears. She could predict weather changes by listening to bird songs, locate lost pets by following scent trails invisible to humans, and identify illnesses in animals before symptoms became apparent to veterinarians. Her parents realized they were raising a child who might represent the next step in human evolution, someone who had never lost the ancient connection between humans and the natural world. One evening, as Grace tucked Luna into bed, she asked her daughter about the future. "Luna, do you think other children will learn to talk to animals like you do?" Luna considered the question with her characteristic seriousness. "Some children already know how," she said. "But grown-ups tell them animals don't really talk. Children stop listening. Luna lucky? Mama and Papa believe Luna." Grace realized that Luna's gift might not be unique, but rather a natural ability that most children lose as they're taught that animal communication is impossible. That night, Grace made a decision that would affect not just Luna's future, but potentially the future of human-animal relationships worldwide. She began working with Dr. Vasquez and Dr. Chen to establish the Willowbrook Institute for Interspecies Communication, dedicated to studying and preserving the natural communication abilities that some children seem to possess. The Institute's mission would be to identify children with animal communication abilities, protect them from exploitation, and develop educational programs that could help other children maintain or redevelop their connection with wildlife. But as plans for the Institute developed, Luna provided an insight that would shape its entire approach. Not just children who talk to animals, Luna told the founding committee during one of their meetings. Animals also choose special humans to talk to, like how Bella chose Luna. Animals very careful who they trust. This revelation led to a fundamental shift in thinking about animal communication. Rather than viewing it as a human ability to understand animals, the researchers began to understand it as a mutual choice, animals actively selecting certain humans as communication partners. The implications were profound. If animals were choosing specific humans to communicate with, it suggested a level of intelligence and social planning that most scientists had never attributed to wildlife. As Luna's 4th birthday approached, the Willowbrook Institute was ready to begin its work. The institute had received funding from sources around the world, all eager to support research into interspecies communication. But the most important endorsement came from an unexpected source. On the morning of Luna's birthday, Grace found her daughter standing at the fence between their yard and the preserve, apparently engaged in an intense conversation with a group of various animals: bears, deer, raccoons, and several species of birds. When Luna finished her conversation and turned back toward the house, she was carrying a small bundle wrapped in leaves. "Birthday present from animal friends," Luna announced, "for Luna and for Institute." Inside the leaf wrapping was a collection of seeds from plants that no botanist on the research team could identify. Luna explained that these were seeds from friendship plants, vegetation that only grew when humans and animals worked together to plant and care for them. "Animal friends want to make special garden at Institute," Luna said. "Garden where humans and animals can meet safely, where children can learn friend talk, where healing plants grow strong." The symbolism was perfect. The Willowbrook Institute would begin its work by creating a shared space where humans and animals could interact safely and naturally. But as plans for the Friendship Garden moved forward, Luna shared news that would test everyone's faith in the project. "Animal friends very worried," Luna told Dr. Vasquez during one of their regular meetings. "Other humans coming to forest. Humans who want to hurt animals. Take animal homes for building human things." Dr. Vasquez felt her heart sink. She had heard rumors about development pressures on Willowbrook Nature Reserve, but had hoped they wouldn't materialize. "What kind of humans, Luna?" she asked gently. Luna's expression was more serious than anyone had ever seen it. "Humans who don't believe animals are friends. Humans who think animals are just things to use or push away. They want to cut trees, build big human houses where animals live now." The threat was real. A major development company had been quietly purchasing land adjacent to the preserve, with plans to build a large residential complex that would eliminate much of the wildlife habitat. But Luna's animal friends weren't planning to retreat without a fight. "Animal friends making plan," Luna announced. "Need human friends to help. Big plan to show all humans that animals are smart, are important, are friends." When Dr. Vasquez asked for details, Luna's response would set in motion the most ambitious interspecies collaboration ever attempted. "Animals want to show humans how smart they are," Luna explained. "Want to prove they can help humans, can work together with humans. Want to save Forest Home and help human children at same time." The plan that Luna outlined, as translated from her animal friends, was breathtaking in its scope and ambition. The wildlife of Willowbrook Reserve was proposing to demonstrate their intelligence and value to humans by actively participating in medical research, environmental restoration, and educational programs. But the success of this plan would depend on something that had never been attempted before: convincing a skeptical world that animals were not just intelligent, but actively interested in partnering with humans for mutual benefit. As Luna finished explaining the animal's proposal, She looked at Dr. Vasquez with complete confidence. "Will you help animal friends save their home?" she asked. Dr. Vasquez realized she was being asked to champion a cause that would either revolutionize human-animal relationships or end her scientific career. Looking into Luna's trusting eyes, she knew there was only one answer she could give. "Yes," Dr. Vasquez said without hesitation. "We'll help them save their home." What happened next would become known as the Willowbrook miracle, an event that transformed humanity's relationship with the natural world forever. Within days of Luna's translation of the animal's plan, something unprecedented began happening throughout Willowbrook Nature Reserve. Animals that had never been seen working together started appearing in organized groups near the hospital and the planned institute site. Dr. Chen was the first to witness what the animals were planning. She arrived at the hospital early one morning to find the entire front lawn covered with medicinal plants, arranged in precise patterns that clearly indicated intelligent design. Attached to each plant grouping was a small bundle of bark with symbols carved into it. When Luna arrived with her parents to translate the bark messages, the scope of the animal's knowledge became clear. "This plant for heart sickness in old humans," Luna read from the first bark tablet. "This one for breathing problems in small children. This one for broken bones healing faster." Plant after plant was identified with specific medical applications, many of which were unknown to modern medicine. But when Dr. Chen had the plants analyzed, every single one contained compounds that were indeed beneficial for the conditions the animals had identified. Marcus, whose own connection to animals had been growing stronger, made the next discovery. Behind the hospital, a family of beavers had constructed an intricate water filtration system using natural materials. The filtered water, when tested, was purer than anything the hospital's mechanical filtration could produce. But the most amazing development came when Luna announced that the animals wanted to demonstrate their healing abilities directly. "Animal friends want to show human doctors how forest medicine works," Luna explained to Dr. Chen and Dr. Vasquez. "Want to work together to help sick children." The first joint human-animal medical consultation took place on a Tuesday morning that would be remembered in medical history forever. In the pediatric ward, a young boy named Tommy was struggling with an autoimmune condition that wasn't responding to traditional treatment. Luna, serving as translator, brought together Dr. Chen, Dr. Rivers, the veterinarian, and a remarkable assembly of animals led by Bella. The consultation lasted 3 hours, with the animals providing detailed information about natural remedies and treatment approaches that complemented rather than replaced modern medicine. The treatment plan they developed combined traditional medical care with precisely timed applications of animal-identified plants, exposure to specific natural environments, and interaction with therapy animals who seemed to understand exactly how to provide emotional support. Tommy's recovery was swift and complete, but more importantly, the collaboration established a new model for medical care that honored both human scientific knowledge and animal natural wisdom. As word of these miraculous collaborations spread, something unexpected happened. The development company that had been planning to build on the reserve land began receiving pressure from their own investors and the general public to reconsider their plans. But the animals had one more demonstration planned that would settle the matter permanently. On the day the city council was scheduled to vote on the development permits, Luna woke her parents before dawn with urgent news. "Animal friends ready for big showing," she announced. "All humans must come see. Bring people who want to hurt forest. Show them why animals must stay." By mid-morning, a crowd had gathered at the edge of Willowbrook Nature Reserve, unlike anything the town had ever seen. Hospital staff, researchers, city officials, developers, and hundreds of curious residents all waited to see what the animals had planned. What emerged from the forest took everyone's breath away. Led by Bella and her cub, a procession of animals began filing out of the reserve. But they weren't fleeing. They were presenting themselves in an organized demonstration of intelligence and cooperation that defied everything humans thought they knew about wildlife. The bears came first, carrying bundles of medicinal plants arranged by medical condition. Following them were deer families, each group carrying carefully selected seeds for different types of healing gardens. Raccoons followed with small containers of pure water from hidden forest springs. Birds flew overhead in formations that spelled out simple words when viewed from above. Friends, heal, together. But the most powerful moment came when the animals began demonstrating their knowledge directly to the assembled humans. A pack of wolves approached a group of volunteer medical students, each wolf carrying a different plant. Through Luna's translation, they proceeded to teach an impromptu lesson on herbal medicine that was more comprehensive than anything the students had learned in their formal education. A family of foxes demonstrated advanced problem-solving by working together to operate simple mechanical devices, showing intelligence levels that amazed the observing scientists. Most moving of all, Bella approached the microphone that had been set up for city officials and made a series of vocalizations that Luna translated for the crowd. Bella says animals not ask humans to leave human homes. Luna's young voice carried across the gathering. Animals only ask humans to share Earth home. Animals want to help humans be healthy, help human children grow strong. But animals need forest home to live, to learn, to teach animal children too. The crowd was completely silent as Luna continued translating Bella's message. Bella says, if humans let animals keep forest home, animals will share all forest medicine knowledge, will help human doctors heal sick children, will work together to make world better for all children, human children and animal children. When Luna finished speaking, something unprecedented happened. The lead developer, a man named Richard Crawford, who had been planning the residential complex, stepped forward and asked to address the crowd. In 30 years of development work, Crawford said, his voice shaking with emotion, I have never seen anything like this. These animals are demonstrating intelligence, compassion, and a willingness to work with humans that I didn't believe was possible. He paused, looking at Bella and then at Luna. I'm withdrawing our development application, he announced. This land belongs to these animals, and they've proven they can use it to benefit both their families and ours. The crowd erupted in applause, but the animals weren't finished with their demonstrations. Throughout the rest of the day, they continued to work with human doctors, teachers, and researchers, sharing knowledge that would take years to fully understand and implement. They showed techniques for natural farming that could increase crop yields without harming the environment. They demonstrated early warning systems for natural disasters that relied on animal sensory abilities. They even provided solutions for human psychological problems, showing how interaction with specific animals could treat depression, anxiety, and trauma. As the sun began to set on this extraordinary day, Luna made one final translation that summarized everything that had happened. Animal friends say this is beginning, not ending, she told the gathered crowd. Say humans and animals can make world beautiful together. Say animal children and human children can grow up as friends, learn from each other, help each other. Dr. Vasquez stepped forward to make an official announcement. Today marks the establishment of the Willowbrook Interspecies Collaboration Zone, she declared. This will be the first officially recognized area where humans and animals work together as equals, sharing knowledge and resources for the benefit of all. But perhaps the most fitting conclusion came from an unexpected source. Tommy, the young boy whose autoimmune condition had been cured through the joint human-animal treatment, had been brought to witness the day's events. As the crowd began to disperse, he walked up to Bella and offered her a drawing he had made. The drawing showed children and animals playing together in a garden, with a hospital in the background, where both human and animal doctors worked side by side to help sick children. Bella accepted the drawing gently, then did something that brought tears to every observer's eyes. She carefully carried the drawing to a large oak tree at the edge of the clearing and placed it in a hollow in the trunk. Then she gathered small stones and arranged them around the base of the tree. Luna translated her actions, Bella making Promise Place, drawing shows dream of human and animal friends working together always. Promise Place means dream will come true. As families began heading home, Luna had one final conversation with Bella. The exchange was longer than usual, and Luna's expression grew thoughtful as she listened. Finally, she turned to her parents with a smile that seemed to hold all the wisdom of the forest. Bella says Luna did good job helping human and animal friends understand each other, she reported. Says Luna's burn hurt brought something beautiful, brought different families together. Says sometimes good things grow from sad things, like flowers growing in forest after fire. Grace hugged her daughter, marveling at how a traumatic accident had led to the most beautiful discovery of her lifetime. As they walked home together, Luna looked back once at the forest where her animal friends were returning to their homes. "Mama," Luna said quietly, "Luna thinks this was what was supposed to happen. Luna thinks maybe Luna got hurt so Luna could help make friends between humans and animals." Grace realized her daughter was probably right. What had started as a mother's worst nightmare, her child being seriously injured, had become the catalyst for a transformation that would benefit countless children, both human and animal, for generations to come. Years later, when researchers studied the events at Willowbrook, they would identify it as the turning point when humanity rediscovered its ancient connection with the natural world. The collaboration between human medicine and animal wisdom led to breakthrough treatments for dozens of conditions. The partnership between human intelligence and animal instincts solved environmental problems that had seemed impossible. Most importantly, children around the world began growing up in a reality where talking to animals wasn't considered fantasy, but recognized as a natural ability that could benefit everyone. Luna continued to serve as one of the primary translators between species, but she was no longer alone. Other children began demonstrating similar abilities, and programs were established to nurture rather than suppress these gifts. Marcus became a pioneer in animal-assisted therapy, working with bear cubs and other young animals to help injured children heal faster and more completely. Dr. Chen revolutionized pediatric medicine by integrating animal wisdom into treatment protocols, leading to healing rates that amazed the medical community worldwide. And Bella remained a frequent visitor to the hospital, now officially recognized as the first non-human medical consultant in history. But perhaps the most beautiful outcome was the simplest one. In the friendship garden that grew from the seeds the animals had provided, human children and animal children played together daily, learning from each other in ways that enriched both species. The scar on Luna's arm, which had once represented trauma and pain, became a symbol of hope and healing. She would often show it to visiting children, explaining that sometimes the hardest experiences lead to the most wonderful discoveries. "My hurt brought me to my best friends," Luna would tell them, gesturing toward the animals that were always nearby, "and now we all help each other feel better." The Willowbrook miracle proved that healing comes in many forms, that wisdom exists in unexpected places, and that the bonds between all living beings are stronger than the barriers that seem to separate them. In the end, a mother bear's instinct to help a crying child had awakened something that had been sleeping in humanity for too long, the understanding that we are all part of one family, sharing one home, and that our greatest strength comes from caring for each other across all the beautiful differences that make life rich and wonderful. The forest that had almost been lost became a thriving center of interspecies collaboration. The hospital that had seemed like a place of fear and pain became a beacon of hope and healing. And the little girl whose burn had started it all grew up to become a bridge between worlds, proving that love truly is the most powerful medicine of all. As Luna often said in the years that followed, everyone just needed to remember how to listen with their hearts instead of just their ears. And in listening with their hearts, humans rediscovered the magic that had been waiting for them in the wilderness all along. The magic of friendship, understanding, and unconditional love that knows no boundaries between species, no limits on compassion, and no end to the healing power of connection. The friendship between a burned toddler and a worried mother bear had grown into something that transformed the world, proving that sometimes the smallest acts of kindness create the most extraordinary ripples of change. And they all lived better, more connected, and more wonderfully than anyone had dared to imagine possible.